Welcome back, everybody, to our partner interview series. My name is Chelsea Woods Turner. I'm a senior librarian here at the New Brunswick Free Public Library, and we've been doing these interviews as a way to help you learn about different services around town for you to access. And today I have three folks with me from New Brunswick Tomorrow to talk about their Health Focus initiative. So Manny, would you introduce yourself to us?
Sure. My name is Manuel Castañeda. I'm the Director of Community Health at New Brunswick Tomorrow.
Wonderful. Alicia?
Hi everyone, my name is Alicia Cook. I'm the Associate Director of Senior Services at New Brunswick Tomorrow.
Great. Mamadi.
Hi everyone, my name is Mamadi Conte. I'm the Community Health Coordinator at New Brunswick Tomorrow.
Wonderful. Thank you all so much for being with me here today. So could you tell us a little bit about what Health Focus is?
Yeah, so at New Brunswick Tomorrow, our mission is to improve the quality of life of New Brunswick residents. And in our Health Focus, it's just that. It's looking at health and social determinants of health, so stuff that affects health, and trying to identify the prevalent needs of our community so that we can then convene with our community stakeholders, our partners here in New Brunswick, in order to discuss and find solutions to meet those needs. So we range from everything such as healthcare, so access to healthcare, to healthy housing, right, which is a social determinant of health. You know, where you live and how you live will both indirectly and directly affect your health. So I'd like to say that when in the health space, we pretty much deal with everything, in you know, because in a sense, everything affects or is affected by health in one way or another.
Absolutely. It sounds like you address the whole person, which is great. So are you guys offering modified services during COVID-19, and what are some of those services?
Well, absolutely. You know, COVID-19 is a health issue, and as a health issue, you know, that's us right there in the forefront. And so the major thing that we offer, I would say, is through our Live Well, Be in New Brunswick public health campaign, is information around COVID and anything, whether it's directly or indirectly related to COVID, right? We've gotten to the point where we actually created a COVID-19 resource page on our Live Well, Be in New Brunswick website. So the Live Well, Be in New Brunswick public health campaign is supported by both a website and I just lost my
It's an app, right?
Yes,
Yeah.
thank you.
Yeah.
It's one of those moments, senior moments.
Yep.
We'll talk to that about with Alicia. Yeah, our app, right? But we also are very present within our social media outlets. And so we use these three vehicles as a way to get that information out. So Mamadi, you know, you could speak more in terms of the information and how we getting information out with respects to COVID.
Yeah, thank you for that. Through our COVID-19 response page, we have made it our mission to make sure we're putting out reliable information and resources to our community. On the page, we include information about COVID from CDC, what COVID is, how you can take care of yourself during this time, and what to expect if you do catch it. But we also do include information specific to New Brunswick as far as services. We have information about behavioral health, active living, senior services, but we also taken the time to provide information about tenants, you know, what can you do during these difficult times if you're struggling, and as well as New Brunswick has come together to create different incentives for the people. You have the Dignity Center on Joyce Kilmer for the homeless to take showers, and then we also have the hand washing stations that you find downtown New Brunswick. So you could go and find that on our website, and you also can access the COVID-19 resource page on our mobile app. And then during this time, we've also taken the opportunity to put out PSA messaging out to our audience on social media, on Instagram, Facebook, and Twitter daily, posting at least 3 times a day, putting out updated information about our partners, any services or programs that have changed due to COVID. So we're just making sure that we're keeping people informed every single day.
Yeah, we're really excited that, you know, with the advent of the new school year coming in, we're going to really double down on our focus on mental health and mental health for our youth. So there's going to be a lot of messaging and information about, you know, mental health itself, the importance of it, you know, resiliency. So, you know, self-help skills and techniques that people can use, really utilizing us as that service to hopefully get people really thinking about their mental health, because we know that on top of physical health and everything that COVID has affected, mental health is one of the major issues affecting our community, with increased anxiety, stressors, and depression, right? So we want to make sure that we're addressing that as much as we can, and providing the information on available resources that can help people through that.
Yeah, absolutely. Yes. Yeah, I have been following you guys on social media, and you have some great posts, very useful, practical stuff. So encourage everybody to follow you guys. So what is like the first point of contact, would you say, to access your services? Is it social media? Is it a website? Is it a telephone number? How can people make sure that they get in touch with you?
I think it's all of the above, to be quite honest. So our social media is there. We are looking and monitoring, make sure people, if they have if they supply questions or comments within our comment section, we make it a point to get back to people. But you can leave messages absolutely on our website. You can call us. So we're really looking for that. In addition to LiveWell, we're also making sure that we're going out in the community and really trying to find out what the prevalent issues are with respects to health, right? Especially with COVID, right? So we have a team of community health ambassadors, which are regular residents of New Brunswick that were trained on being able to talk and outreach to the community, as well as be trained in understanding of health issues overall, right? So we have them surveying the community so that we get a better understanding of what the needs are, so that we can best inform partners in the community as to how we can best address that. And one of the major areas that we're looking to address is seniors, right? Our senior population, which is sometimes, unfortunately, an invisible voice, right? And, someone that's really put in a lot of effort recently to really try to reach our senior population is Alicia. So I'm gonna let Alicia speak a bit more about outreaching seniors and how they can best, utilize Alicia now in her current position.
Right. Thanks, Manny. Yes. So ultimately what, I've been working on, being that I am new and my position is new, is trying to figure out how can I establish the relationship with the seniors, because most know that's super important, the trust factor. You really can't go too far, with seniors. That's anyone, but especially with seniors, if they do not trust you. So being that we are in these unprecedented times, it has been kind of challenging, but there has been some breakthroughs. So I have been able to connect with some of the different coordinators at some of the different apartment buildings that the seniors live in New Brunswick. I just recently connected with one of the CHAs. So now we're working to, reach out to the seniors that were identified within households within New Brunswick, and trying to figure out ways that we can really counteract social isolation during this time and help bring them to a place of connectivity, and let them know overall that we're here, we care, and their lives matter. It's worth it. And so we've been partnering with different organizations like the hospitals, Robert Wood, St. Peter's, Meals on Wheels, doing different food distribution, mass distribution. I distributed so far, I believe, about 1,600 care kits so far to some of the seniors that I was able to identify within those senior buildings and households. So it's been a great challenge to say the least, but worthwhile in the feedback so far that I'm getting. So I just can't wait to see what else we have in store to do with the seniors. And I'm hoping that, it's an even greater breakthrough before the end of this year.
Yeah, absolutely. Yes, it is such an important population to reach. And so many services right now are focused on youth and families, and those are very important, but it's so great to know that you guys are also caring for the elders in our community. That's wonderful. Is there anything else you want the viewers to know about Health Focus before we wrap up?
No, but yeah, other than we'd love to hear from you. We really would, so, utilize our LiveWell, app, look us up on Facebook, Instagram, leave us messages that way. Call us, whatever you feel comfortable in terms of outreaching to us. We are ready and willing to listen, because that's what we want to know. We want to hear from you in order to really understand the health issues overall, so that we can help them be part of that solution with our community.
Yeah. Wonderful. Thank you all so much for being with me here today. And for our viewers, as always, all of the contact information, links, phone numbers, Social media pages will be in the description of this video. You can click right there, or you can always call the library if you have any questions. Thanks so much.
Thank you.
Thank you.